I'm very happy that I'm a guest talk for you all, for my students. And once again, I wish everyone a happy breastfeeding week. So I hope so. A celebration is going on in our college. And today, uh, I think so you will be aware of our topic, that is infant and young child feeding. And young child feeding. So can you see everyone? The slide?
Yes, ma'am.
Yes, ma'am.
Visible for everyone? Is it visible, students?
Yes, ma'am.
Okay. So we'll see. So infant here, 0 to 11 month. Young child is up to toddler, that is 2 year, and CF, that is child and feeding. So this is we are going to discuss a topic regarding this. So I'll be talking to you how, what are the categories comes under IYCF. So how the global strategy was, what is the main cause, why this IYCF is given importance. Okay, so optimal practices of IYCF, technical guidelines. Okay, and regarding the complementary feeding, regarding the breastfeeding, HIV infant feeding, and for the specific conditions. Okay, so we'll see the interventions of practices of IYCF. Next, here the infant young child feeding, that is from 0 to 11 months till 2 years, the breastfeeding has been given appropriately. Okay, so till the toddler period, the feeding has been proceeded. So next, we'll see the global strategy here. So mainly malnutrition is the main responsible for the death of the children. So this infant and young child feeding has been given a essential part, integral part of this global strategy. Okay, so the malnutrition, which indirectly is about like over 50 percentage and 10 million deaths among children under 5 age. Okay, so this WHO and UNICEF, they have made this world attention for the impact of feeding practice in the young and infant children. Okay, so because the first year of life, that is over 2/3 of death occurred in this children, especially due to this feeding practice. Okay, and malnutrition, improper feeding practice and malnutrition in the children. Okay, so in that circle, you can see in that survey, malnutrition takes place main cause. Okay, that is 54 percentage than the other. Okay, so you can see the next thing, next slide very clearly, what are the major causes for death rate among children, under 5 children. So first foremost, the death associated is with malnutrition. Okay, that is 54 percentage. So for that, they have given an integral part for child feeding, infant and child feeding. Okay, the other things like acute respiratory infection, diarrheal disease, malaria, measles, HIV, AIDS, perinatal, then other causes. These all are the other cause, but the major causes due to malnutrition. Okay. So we'll see some of the optimal infant young child feeding practices. First is early initiation of breastfeeding. That is, immediately soon after the birth of the child, within 1 hour, the exclusive breastfeeding should be started till first 6 months of the life. That is 180 days. Later, along with breastfeeding, complementary feeding also, complementary food also should be provided. Okay, like solid, semi-solid, or soft food after the 6 months. That is 180 days. And after later on, beyond 2 years, the breastfeeding also can be progress, that is continued. Okay, And according to the age, appropriate complementary feeding should be given along with breastfeeding. Okay. And if the child or infant, young infant is ill, so during or after, the children should be kept on participate on actively breastfeeding. So the mother should be given an encouragement and support for active feeding for the child. So these are the optimal infant young feeding. Next, we'll see some technical guidelines. Okay, so there are 4 technical guidelines. They are breastfeeding, complementary feeding, HIV and infant feeding, and special situation. Breastfeeding, as all we know, that is a golden standard where we promote to the mother. Okay, that is called for the other caregiver. Okay, especially during the feeding option for the babies. So that's called gold standard of breastfeeding. Okay, and during the antenatal counseling, during the breastfeeding, okay, when the mother is on breastfeeding, antenatal counseling, okay, can be given before the pregnancy starts. Okay, when the preconception period itself, the antenatal counseling can be given individually or group to the mother. Okay, and next is operative birth. In the breastfeeding itself, if it is LSES, okay, operative birth, so the bedding of the mother, okay, bedding of the mother in the sense positioning, okay, keeping close towards the chest, that is KMC. What is KMC? Anybody?
Kangaroo mother care.
Yeah. Okay. So kangaroo mother care has been provided. Okay, supported. Okay, so mother should be motivated and supported for initiation of the breastfeeding. That is exclusive breastfeeding within 1 month. Skin to skin contact again comes under KMC. That is bedding in mother and baby pair. I'll show the picture. Okay, and breast crawl. Breast crawl in the sense keeping the baby near to the breast, and the baby will search for the breast and uh, giving the breastfeeding, getting the breastfeed. Okay. So while the mother breastfeeds the baby, so communication, that is important. That is looking into the eyes, touch and caress the baby while feeding. Okay. And next is that KMC. Okay. That is promoted as a local practice to keep the womb warm, or baby bondage. Okay. To build up the baby mother bonding relationship. Okay. So you can see the pictures, that is bedding in mother and baby pair. Okay. Then breast crawl, the middle one is breast crawl. Okay. So place the baby on the mother tummy and allow it to find the breast. And next, mother looking into the baby while feeding. Okay. So these are the uh, breastfeeding, operative birth. Okay. During the operative birth and skin to skin contact, and how the mother gets communicate, and explaining regarding the bedding in mother and breast crawl. Okay. Next, in this breastfeeding, first milk, what is called, the first milk is called in breastfeeding? Anybody? The first milk is named as?
Colostrum.
Yes.
Colostrum.
So colostrum, okay, which should not be discarded, okay, which gives a healthy, okay, which lowers the risk of infection, okay, and which is very essential for the newborn. Okay, so that should not be discarded. Instead, it should be given. What is prelacteal fluids? What is prelacteal fluids? Yes. What is prelacteal fluids? Prelacteal fluids means giving unboiled cow milk, goat milk, okay, other than the mother's milk, breast milk. Okay, so they are called prelacteal fluids. Okay. Yeah. So, no prelactal fluids should be entertained. Okay, only breastfeeding, breast mother milk should be given. No other cow milk or unboiled milk or goat milk. Okay, these fluids should not be given. Next, on cue. On cue means on demand. Okay, so baby should be fed on demand of the child, like on crying. Okay, so early feeding cues like sucking movements, sucking sounds, hand to mouth movement, rapid eye movement, sighing sound, lip smacking, and restlessness. So these are the on cue demand of the baby. Okay. So next, exclusive breastfeeding, like as we know, it is practiced from the birth to 6 months, and later 6 month complementary food can be given. Okay, so minimum breastfeeding should be given 2 years and beyond, even during the like first year of life, second year of life of the baby can be given a breastfeeding. So frequency should be 4 to 6 times in 24 hours. Okay, because the feed will like the baby will often void. Okay, so the baby will have a hunger, starving. Okay, immediately the baby will have a starving, hungry feeling of hunger. So 4 to 6 times the breastfeeding can be given, including night feed. Okay, so next we'll see regarding the breastfeeding for working mother. Okay, so first thing, expressed breast milk. So that is one way where the mother will express the breast milk and storage, and then the baby will be fed that. And the baby can be put into a workplace, that is crutch, carrying the baby to the workplace and leaving for the a daycare. Okay, that is the thing. And next is Hirkani's room. Hirkani's room means Hirkani Kaksha room. Okay, this is also for the working mother. So what happens here? It is specially for the mothers who can breastfeed the baby. Okay, so it is a special room called lactating room. Hirkani's room means it is a special room called lactating room where the mothers can breastfeed their babies. Okay, next, so we saw regarding breastfeeding, complementary feeding, regarding the working mother breastfeeds, and health visit. Next, okay, in the breastfeeding, last one, health visit. So here, artificial feeding regarding the bottle feeding. Okay, this health visitors, they will be explaining what are the advantage, what are the disadvantage. Okay, so that will be explained here, and regarding the milk substitutes also will be explained here. Okay, in the emergency cases, okay, that I will explain later on in IMS Act. Okay, so here they will just explain what are the what are the demerits of artificial feeding and bottle feeding and infant milk substitutes. Okay, so how to avoid and why, when it is can be used. Okay, so this will be explained in the health visit, and regarding the, according to WHO, the growth monitoring also has been facilitated. Okay, and the mother also will be explained how the breastfeeding can be carried out in the places, public places easily. Okay, so these are the health visits in the breastfeeding. So that's all about breastfeeding in the optimal IYC, in the technical guidelines. Sorry. So in breastfeeding, we saw about the golden standard regarding the antenatal counseling, regarding the LSCS birth, okay, that is operative birth. In that we saw KMC, bedding, and breast crawl. Regarding the non-prelactal feed, okay, and working mother. What are the options for the working mother? We saw that is express breast milk, Hirkani's room, and regarding the crutch. And last we saw regarding health visit. Understood about breastfeeding in the technical guidelines? Students?
Yes, ma'am.
Yeah, what is
Yes,
Hirkani's room? Can anyone say?
Ma'am, it's
Hirkani's room.
lactating room.
Yeah, it's a Hirkani Kaksha room. That is called lactating room. So what it does? What is the function of that? So mothers can breastfeed their babies. Okay. Next, we'll move on to complementary feeding. What is complementary feeding, students?
Other than breast milk, what we are
Yeah.
giving.
Yes. So here, weaning, the term will be avoided here. Instead, we say complementary feeding, which are locally available food, okay, which is introduced once the baby completes the 6 month, okay, and along with that, breastfeeding will be given. Okay, so see here, the meal, whatever given for the child, it should be thick enough, not thin. It should be energy dense meal, okay, like sugar or jaggery, ghee, butter. Okay, it should be thick enough that it should not flow off from the spoon. You can see the diagram, okay, and it should be a fermented porridge, okay, like flour or sprouted grains. Okay, so these things can be provided as a complementary feeding. As parents, they should keep it in mind, like what they can identify what is a staple homemade food. Okay, that food can be uh, encouraged for the children, like cereal, pulses, mixture. Okay, and food can be encouraged like vitamin A rich foods, iodized salt, iron fortified food, and variety of complementary foods can be given for the baby. Junk food, the avoiding things. Okay, don'ts. Okay, don'ts in the complementary food. That food which should be avoided is junk food, especially processed, ready-made food, commercial food. Okay, that should be avoided for the children. And drinks such as, which is very less in nutrition value, like tea, coffee, sugary drinks should be avoided. And hygienic practices can be followed, like preparing, storing, and feeding. Okay, these kind of foods can be given. And next is responsive feeding. Okay, so first we saw regarding the parents what to be identified, then foods to be encouraged, and avoiding food, that is junk food should be avoided. Drinks which are less in nutritive value, that should be avoided. Hygienic practices should be maintained. Okay, and responsive feeding can be given, like giving them a promoting or encouraging them, okay, in getting a hygienic practiced food. Okay, and next is self feeding of the child also will be encouraged, and force feeding should be avoided. If the baby is not having a hunger, if the baby wants to play, so let them play. When they get starved, okay, then the food can be given, feed for the baby. Not until unless we should not do force feeding for the baby. And especially we should not provide discourage using grinders and mixers for crushing the food, okay, solid foods. If it is very hard, okay, but other than that, the semi solid foods should not be crushed, okay, its values may go off. Okay, so these are the nutrition food groups, that is staple food, wheat, corn, rice, protein, minerals and vitamins, and calorie food. These are the vegetables. Okay, so here the responsive feeding. So parents will be feeding them. Then self-feeding will be encouraged. This both, and force feeding should be avoided. Okay, so that's all about the complementary feeding here. So once again, I'll tell complementary feeding, especially which is, it should be thick food. Okay, the feed will be given once the baby completes its 6 month, along with breastfeeding. This complementary feeding is given, which is locally available. Okay. Each meal should have energy dense with thick meal with fermented porridge. Parents should identify, okay, what is a staple food, and vitamin A rich food and iodized salt, iron fortified food, which is encouraged for the baby. And variety of food and complementary feeding is also encouraged for the baby. We should avoid junk food, low nutritive value drinks. Hygienic practice like preparation, storage, and feeding can be encouraged. Responsive feeding practice is promoted. Self feeding is encouraged. Force feeding is discouraged. Okay, so that's all about complementary feeding. And last, we'll see regarding HIV and infant feeding. So here, during the antenatal counseling, okay, antenatal period itself, they will give a counseling that should not give a ERF feeding. Instead, EBF feeding is better. Okay, that is exclusive breastfeeding can be provided for the child. Okay, so the mother who is on antiretroviral treatment, okay, early antiretroviral treatment, okay. So according to the prophylaxis, okay, for example, it will be for 6 weeks. So according to that, this breastfeeding is recommended. Okay, so in this period, antenatal period, they will be giving all this counseling. Okay, so here in this chart, they'll be given clearly like uninfected of infant who are uninfected, mother who is diagnosed at the labor time or postpartum, or infant who are diagnosed after the birth in HIV, and mother who is in antiretroviral treatment regimen who is getting interrupted with this exclusive breastfeeding. Okay, so mothers exposed to HIV. So first thing is exclusive breastfeeding, which is given in all the category except that all 6 months it will be given, and in between it will be stopped, and later it will be promoted. Okay, and complementary feeding after start at the 6 month, and the retroviral treatment, and during that time also this breastfeeding is which is initiated, and infant prophylaxis. In this, we see NVP. NVP means nivirapine, okay, which is a non-nucleoside reverse transcriptase inhibitor. Okay, so what it does? It works for lowering the amount of HIV in blood. Okay, this is the infant prophylaxis, that is NVP, nevirapine. What it does? It lowers the amount of HIV in the blood of the baby. Okay, it will not cure HIV. Got it? This NVP won't cure HIV, but it will reduce the reproducing the HIV virus, and it also slow down. It will make slow down process. Okay, for reproduction, and it will destroy the destruction. What happens is it affects the immune system, right? So that will get slowed down, and this reproduction of new virus cells also will be very slow in process. It will lower the risk. That's all, but it won't cure the whole HIV and AIDS infection. Okay, so this comes in infant prophylaxis. Then again next, continue breastfeeding in early infant diagnosis. If it is negative, the breastfeeding is continued. If it is positive, later 2 years, okay, it first year it will be given, then later 2 years, if it is positive, again the breastfeeding will be continued for next 2 years, not in the first year. Okay, so according to the negative and positive of HIV, the early infant diagnosis, which is on demand for continued breastfeeding. Okay, so this is about the mother exposed to HIV. Next, we'll see feeding option of infant, that is from 0 to 5 months. Okay, so women with 0 to 6 months of old infant, if the women is in HIV or not known, so exclusive breastfeeding can be initiated. And if HIV infected women, which is confirmed, so locally available animal milks and wet nursing. Okay, wet nursing means a woman who breastfeeds and cares for another's child. Okay, a wet nurse who breastfeed and care for another child. Okay, the other mother. Okay, not the mother, the dies, or a woman, another woman. Okay, who feeds, cares another child. Okay, then exclusive breastfeeding and commercial infant formula, which are available locally in the market. Okay, so this comes under HIV infant feeding. So we saw regarding the antenatal counseling of exclusive breastfeeding as well as exclusive replacement feeding, and we saw regarding the nevirapine, which is a non-nucleotide reverse transaction inhibitor. Okay, and we saw that exclusive breastfeeding is better than exclusive replacement feeding. Okay, And we saw regarding the table that how the mother exposed to HIV. So uh, what all happens, okay, and what should be done. And in next we saw the women with HIV and women who is not infected, not known. So what option can be given for the infant? Okay, so that's all about HIV infant feeding. So last special situations. So this table also says the same in short regarding this first table we saw. Okay, infant exposed to HIV. So here we see some advantage and disadvantage. They say same thing, that instead of giving exclusive replacement feeding, you can go for exclusive breastfeeding until unless there is no harm for the baby, no risk for the baby. If it is harmful, so we saw in this right, this table, same thing. Okay, locally available milk, wet nursing, exclusive breastfeeding, and commercial infant formula can be given for the child. Okay, so feeding in some other condition, that is called special situation. Okay, the fourth one, last one. Okay, so first and foremost is maternal illness, low birth weight babies. In that low birth weight, if it is very low birth weight babies, then GERD, that is gastroesophageal reflux, and emergencies condition. Okay, so in these conditions, what can be done for the feeding of baby? Okay, so first we saw maternal illness. In this primary condition like breastasis, postpartum psychosis, so this should primarily will be treated. Chronic infections also will be primarily treated, and then without any discontinuation of breastfeeding, the baby can be fed properly. Okay, next these are the contraindication drugs, okay, for breastfeeding. Okay, so you can go through that. Yes. So what are the drugs cannot be, if the mother is taking these drugs, so breastfeeding will be not given, avoided. Okay, contraindicated. Next. So as I said, very low birth weight baby. Okay. So here in the low birth weight baby, usually in ICUs, they will be giving expressed breast milk. That is, rooming in will be done. Okay, and the mother will be set for expressing the breast milk, and it will be stored and then feed through NG tubes. Okay, that is one thing. Then for GERD, okay, small frequent feeding can be given for the baby. That is in upright position each 30 minutes. Okay, and burping will be done for the baby. Okay, so this is the very low birth weight baby treatment. And in emergencies, the the lactating mother and pregnant women, okay, they will be given counseling, that nutritional support regarding health and nutritional support priorly, what to do in the emergency case, and they should they should told to be avoid substitute for breast milk, especially bottle feeding. Okay, this will be avoided. Okay, so this will be explained for the pregnant and lactating mothers in the emergency. Okay, now we'll see of feeding of preterm baby. So as I said, for low birth weight baby, the breastfeeding should be given as a expressed breast milk via spoon and katori. Okay, so that slowly the baby can be fed through orally. Okay, and it will be like same like for normal children. That is exclusive breastfeeding for 6 months, and very low birth weight babies, they will have 10 ml per kg of internal fluid, preferably that also along with fluids, breast milk will be given. Okay, and if the own mother it's not available, so donor human milk also can be, the human milk banking. Okay, you might have heard. Okay, through that the baby can be also fed. Okay, so next you can see here a trade, okay, of indicator in India. So here the NFHS, that is National Family Health Survey, and district level household survey. Okay, so these people have shown here that the complementary feeding is having a high percentage. You can see that, okay, from 6 to 9 months. Okay, 6 to 9 months. Here the complementary feeding. Then comes the exclusive breastfeeding, and that is initiation. So see the range. Okay, this is the survey of National Family Health Survey and District Household Survey of IYC F practice in health system. Okay. So next we'll see regarding the intervention, what all they promoted from the health system for infant and young child feeding practices. So first thing, IMS, that is Infant Milk Substitute Act, okay, which is amended on 2003, okay, where this health system, they provided a correct information for the family and the mother, okay, through the community health nurse, and with the skilled counseling, they helped for the family and the women, okay, regarding the Infant Milk Substitute Act. Then they also helped for appropriate feeding through maternity protection. Okay. So how they helped them for appropriate feeding is by regulation of production. Okay. They also supplied the distribution of infant milk, feeding bottles, infant food. Okay. In the infant food, they promoted and protected breastfeeding. And it is also that they have said that this act, this Infant Milk Substitute Act, which extend to whole India, so that all the health workers in the community area having the responsibility, even the government also having the responsibility to give a proper information regarding Infant Milk Substitute Act to the people. Okay, so what these people promoted. Okay, what is the provision of this IMS Act? Okay, so what they did is, firstly, for the 2-year children, up to 2-year children, they promoted food. Okay, and then they've also promoted food before the age of 6 months, the infant food. Okay, firstly, what they did, they supplied the distribution of infant milk. They did the regulation of production of that infant milk substitute, the feeding bottle. Then they also given a promotion and protection act for breastfeeding. Okay, and they also made the integral part that this should be having a responsibility for the government as well as the responsibility of community health workers to give a proper information to the people. Okay, and how they give means through advertisement in the mass media like television, newspaper, magazine, journal. Okay, through radio, pamphlets. So through this infant milk substitute was aware. Okay, made aware to the people. Then they also directly, the health workers, they distributed the product to samples or samples to any persons, like giving a pamphlet, okay, giving an information to the, and directly contacting to the mothers, okay, and also demonstrated to the family member how to feed the product, okay, they demonstrated to the doctor, nurses, okay, and they gave educating material, okay, to the mother, to the family, that how to use the product, how to what are the positive factor of breastfeeding. Okay, so these all are demonstrated for the people, and they also shown cartoons, okay, through leaflets to increase the sales. Okay, posters, place cards. Okay, in the hospital, nursing home, chemistry, this pharmacy shops. Okay, they have given, and directly they also included the health worker to give benefits to the doctors, nurses association through this Infant Milk Substitute Act, that is IMS Act. Okay. And next, if the other thing also they said regarding the IMS Act, if anybody have did like if they have labeled wrong, okay, in the product regarding the, if the quality of infant milk substitute is very less, or the label or container, if it is expired or wrong, so that also will go for punishable imprisonment for the act. Okay, that act has given that if it is misused, okay, if it is wrongly used or quality is very less, so it is punishable. Okay, like up to 6 months to 3 years with the fine of rupees 2,000. Okay, that was the penalty for this IMNC, yes, IMS Act, and promoting IYCF practices, keeping in mind this, as I said, the health worker, they are directly involved to promote the infant and young child feeding. There are three levels, that is health facility, community outreach activity, and community home-based care. Okay, so they gave a facility here, okay, for infant milk substitute, and for the through that the health worker, they provided this infant young child feed. So they have given this health facilities, that is during and after institutional delivery, inpatient services for children in the hospital, as well as outpatient services for pregnant women, mother and children. So direct consultation facilities are given. Okay. So next we'll see some of the key intervention of health facility of IYC that we saw in community-based health facility we saw. Next is community-based and home-based. Okay. In community-based MCH, that is maternal child health. Okay. This contact opportunity, what this community health worker did is they directly went for home visit. Okay. Postnatal home visit for the mother. Okay. And for the family who are village health and nutrition, for village health and nutrition day. They promoted a village health and nutrition day, and they went for a home visit for family. Then they also assessed growth monitoring of the child, health promotion of the mother. Okay, and mother group meeting is also held in the community and home based care. Okay, so these are the activities for the home based care. And last in this topic, we'll see infant young child feeding. What are the 10 steps for successful breastfeeding? So can anybody say any successful steps for breastfeeding according to the national policy? Can anyone say? Just we saw from the beginning, we saw regarding exclusive breastfeeding, exclusive replacement feeding, regarding the KMC. Okay. So can anybody say any two or one successful step for breastfeeding? What can be done for the mother? Please interact, students. What can be done? Can you hear me? Hello. What
Yes,
can be
ma'am.
done? Yeah, what can be done for the steps for successful breastfeeding? Any one or two point you can just tell. What is exclusive breastfeeding?
Ma'am, we have to breastfeed till 6 months.
Yeah. So for that, soon after the delivery of the baby, what shall be done? What we have to encourage the mother?
Exclusive breastfeeding.
Yeah. What should be said to the mother? What information can be told to the mother? See, help the mother for initiating breastfeeding within 1 hour of immediately after the birth of the baby. Okay. Got it? Okay. So you have to tell, you have to teach them the written breastfeeding policy. Okay. And you have to train all the healthcare staff regarding the policy. Okay. Inform all the pregnant women about the benefits and management of breastfeeding. So we saw the breastfeeding benefits for the mother and baby, right? In the first slide. So that should be taught. And initiation of breastfeeding soon after the birth of the baby, within a 1 hour. Okay, we should support the mother. Okay, for initiating the early breastfeeding. Then you have to tell the mother, okay, that how to do the rooming in. Okay, rooming in will be available regarding KMC. Okay, and what are the do's and don'ts for the baby? As we saw in the second complementary feeding, we saw the avoiding things. Okay, so no other substitutes than the mother's milk. Okay, that should be indicated. Then rooming in, as I said, then always on demand, on cue of the baby, encourage breastfeeding. Okay, no pacifiers, no other artificial materials should be used for the baby to lower the risk of infection. Okay, always foster the establishment of breastfeeding, as we saw in our theme. Okay, where a shared responsibility. Okay, where the breastfeeding protection and promotion of the health services. Okay, so that gives the foster of establishment of the breastfeeding, which supports the group and the mother. Okay, so these are the responsibility of the staffs. Okay, so they have the healthcare staff. Okay, so they have to implement this policy to bring up the successful breastfeeding for the mother. Okay, and which will give a benefit for the child. Okay, so that's all about the topic. Okay, so today I have discussed regarding the infant young child feed, about the global strategy we saw, the major causes we saw. The major cause of death is regarding malnutrition, and the optimal IYFC practices like starting the exclusive breastfeeding, then one complementary feeding, then even in the illness feeding should be continued without any interruption. We saw some of the technical guidelines of breastfeeding, complementary feeding, how to feed HIV and infant feed, and in special situations we saw regarding maternal illness, low birth weight baby, geared emergencies, how to feed preterm baby. Okay, these all we saw in the technical guidelines, and also we saw intervention for promoting IYCF practices in health system regarding IMS Act. What is IMS Act? Anybody? What is IMS Act? IMS. Expand. Infant. Please
Milk
tell girls.
substitute.
Yeah. Infant Milk Substitute Act, which was amended on 2003. Okay, and they have brought some of the provisions, key interventions in the community-based and outreach home-based. Okay, and last we saw the 10 successful steps for breastfeeding. Okay, thank you everyone. Do you have any doubts? Anybody? Any doubt? Okay, thank you students for joining my lecture. Okay, and I'm feeling very happy that I have given my students, I got a chance, opportunity for giving a guest lecture on this topic. Thank you everyone for listening patiently. Over to Debalina.
I would like to give vote of thanks. Okay, so very good afternoon to one and all. So I would like to thanks management and principal, that is Dr. Jabarna ma'am, for giving this opportunity to organize this guest lecture. And I would also like to thanks today's guest speaker, that is Jasmine, for taking this invitation and sharing her valuable knowledge with the students on the topic infant and young child feeding. So, and also I would like to thank all the department HODs and teaching faculties and non-teaching faculties for contributing for this guest lecture. And last but not the least, I thanks all the students for their active participation that I see all are present today. Okay, so thank you all. Thank you once again. Thank you, Jasmine, for giving this knowledgeable lecture. This was very helpful.
Thank you, ma'am. Thank you, management, and thank you, college, and thank you, principal, ma'am. Thank you, Debalina. Thank you, HOD, everyone, for giving me this opportunity. And finally, thanks to all the students who have heard my lecture patiently. Thank you, everyone.
Thank you all. Now
Thank
you
you, ma'am.
can leave. You can leave. If you have any doubts, you can clear it, or else you can leave the lecture.
Thank you, ma'am.
Okay, thank you.
Thank you, ma'am.
Thank you, ma'am.
We will be sending you a feedback form. Okay, so please fill that form and you can get certificate. Okay, bye everyone. Bye, Jasmine.
Bye, ma'am.
Bye bye.